Other effects of radiation. Carcinogenic effects. There is human evidence that radiation may contribute to the induction of various kinds of neoplastic disease. This evidence includes the following. Early radiologists and dentists manifested a significant increase in skin malignancies and leukemias as compared to physicians who did not use radiation. Radium dial painters who ingested significant amounts of radioactive radium had subsequently shown an increased incidence of bone malignancies. My old program director told me a story about radioactive spiders that would glow as a result of contamination from inhabiting factories containing radium paint, where workers would paint watch dials to glow in the dark. Unfortunately, these spiders, to our knowledge, have not caused the creation of any superheroes. Uranium miners have also shown an increased incidence of lung cancer. The Japanese survivors of Hiroshima and Nagasaki have an increased incidence of leukemia and other neoplasms. The most frequently occurring radiation-induced cancers include, in descending order of susceptibility, female breast, thyroid gland, especially in women and young children, hemopoietic tissue, lungs, GI tract, and bones. Embryological effects. Considering the fact that immature, undifferentiated, and rapidly dividing cells are highly sensitive to radiation, it is not surprising that embryonic and fetal tissues are readily damaged by even relatively low doses of radiation. Absorbed doses of about 50 rads, which is 5 millisieverts, or 0.5 rem per month, to the fetus, can result in a spontaneous abortion. It has been known in animal experiments that deleterious effects may be produced with doses of as little as 10 rads delivered to the embryo. There is no reason to believe that the human embryo is not equally susceptible to radiation damage. The specific type of fetal radiation damage is related to the dose and to the stage of pregnancy during which the irradiation takes place. In terms of embryonic death, the earliest stages of pregnancy, perhaps the first few weeks in human beings, are the most radiosensitive. From the standpoint of practical radiation protection, this early sensitivity is of great significance because pregnancy may well be unsuspected. During the 2nd through 6th weeks of human gestation, the production of morphological defects in the newborn is a major consideration. During later stages of pregnancy, fetal tissue is more resistant to damage by radiation. However, functional damage, particularly those involving the central nervous system, may result from late exposure. These usually involve subtle alterations in learning patterns in development, and may have a considerable latent period before they manifest themselves.